My name is David Rosmarin, Vice Chair of Education and Research in the Dermatology Department at Tufts Medical Center. I help specialize in inflammatory disorders of the skin, such as atopic dermatitis, also known as eczema. Atopic dermatitis is a problem with the skin as a barrier to the environment. The skin is supposed to protect us from allergens and harsh chemicals. And in some people, it is imperfect. That could be due to a genetic mutation or just other differences. We have to use skin hygiene techniques and other medications in order to try to help patients best control their eczema. Eczema patients can have a wide variety of symptoms. The most common one by far is itch. Almost all eczema patients have itch. But they can also have other symptoms as well, such as soreness, burning, stinging, even pain. Patients with atopic dermatitis suffer a lot. There's a high effect on quality of life. This can be on sleep. There's also high incidence of mental illness, depression. Kids who don't have their atopic dermatitis well controlled can also be at higher risk for attention deficit disorder. So as a dermatologist, we try to help our patients with atopic dermatitis in several ways. It's really important to take a holistic approach. So first, I like to give skin hygiene advice. It's important to minimize soap use. Soaps tend to be very alkali, while the natural pH of the skin is acidic. So that mismatch can cause a drying effect. Also, it's important to take a nice warm to hot shower, but avoid extremes of temperatures, scorching hot or ice cold. There's a balance for patients with eczema, where the more times they wash their hands, that can often irritate the skin. And it's really important to use our hygiene techniques, such as using a lot of moisturizers afterwards. We also advise for clothing that is non-irritating, such as 100% loose-fitting white cotton, and avoid more irritating cloth, such as wool. We also have prescription topical medications, pills, light treatment, injectable medications, and new medicines that are in the pipeline through our clinical trials unit. At Tufts, we really focus on treating patients with individualized care. We have a care team here that is truly dedicated to treating patients with eczema that include myself, pharmacists, fellows, and residents, pharmacy technicians, medical assistants, nurses, all there to really give that individualized care to patients. One of the best aspects of coming to work is a patient who tells you that they can sleep at night, patients who can focus more in school, patients who are going out and enjoying themselves more is extremely gratifying, and the reason why I'm a dermatologist here.